All right. Good morning, everybody. Thank you for joining us. It's been a couple of months. It's great to see everybody back for our meeting for the Health and Wellness Advisory Committee for the City of Charleston for August 6th, 2025. I will now call our meeting to order. I appreciate everybody being here this morning and wanted to mention a couple of things this morning as we get going. First of all, when we wanted to make sure everybody knows that we do have the City of Charleston YouTube channel, and you can watch our meetings. You can share our meetings with other people. You just add in City of Charleston Health and Wellness Advisory Committee to your live meeting lists. Join as as somebody that's following that, and you can certainly share our meetings with anybody. We've got a good meeting lined up this morning. I don't believe Tammy O'Berry's on yet, is she, Paul?
No, I don't see
I
her
don't
yet.
see her, but we do have, if she does come on, I'll introduce her later if she does. She's our new Human Resource Director. We're very excited to have her. She's coming to Charleston from North Myrtle Beach, where she was their Human Resource Director, and has a great background. We're so excited. The City of Charleston's so fortunate to have her, and we look forward to the great work that she's going to do with our human resources for the City of Charleston. But hopefully she'll be able to join us a little bit later. We do have our committee minutes that we need to approve. Paul sent those out earlier. Can I get a motion to approve the meetings from our meeting minutes from June 4th, 2025, please?
So moved.
A motion to approve. Can I get a second?
Second.
All right, we have a motion to approve those minutes in a second. Any additions, deletions, any further discussion? If not, all in favor of approving those minutes, please say aye. Aye.
Aye.
Aye.
Any
Aye.
opposed? Those minutes have been approved. Thank you very much. So we have Dr. Susan Johnson up next. She's the founder and CEO of Nature at Work. We all know Susan because of her work that she's done, the great work she's done at MUSC, and she is now moving to something completely different, and I'm excited to hear about it. So Susan, if you would, please.
All right. Thank you so much. Can y'all see my slides?
Yes.
Yes.
All right, great. Well, thank you. It's great to see y'all. I feel like I've missed a couple meetings. I was actually on the SE7 expedition last month. I spent 30 days traveling across the state, as I have done for the past 4 years, but this was the first year that I actually had the chance to do the full expedition. I know I've talked about that initiative with y'all in the past, but it was really special this year because one, it started on July 1st, and July 1st was my last day at MUSC after 15 years serving as the health promotion director. And it was a platform to launch Nature at Work, which is what I'm going to share with you today. So I'm really excited to be back with you this month and to share this new initiative. Um, I usually start out with a kind of mindful moment and talk about, kind of thinking about your favorite place in the outdoors and taking some, doing some breathing exercises. But I feel like we're all probably, hopefully not too stressed yet because it's so early in the morning. But I just wanted to kind of frame it around your own personal experience with nature. And I think everyone can visualize a place in the outdoors that brings you peace. And it's kind of what we would say maybe your happy place, but where you feel like you're at your best. And that is something that I think resonates with all of us. But then I want to kind of flip the script and talk about what most of us struggle with, and that is actually finding time and prioritizing nature in our lives. So this may seem a bit high to say that, 80% or if you think about in vehicles, over 90% of our lives are spent indoors. And for those of us that are on this committee, I know we're all obviously we are very passionate about our personal health and wellness and promoting that in the community. And so this may be a little bit of a shocker to be like, oh my gosh, this can't be true, because we value it. But if you think about your typical day, for most of us, we start our mornings indoors and we're doing our family things, and then we get in our cars if we're commuting and we drive to work and go into our offices, and we're in our offices most of the day. A lot of us are workaholics, so we work through lunch on our desks on our computers, and then go home and do our family chores and feed folks. And maybe we have some outdoor activities with kids or walking the dog, but it really is difficult in our modern society to address this issue. And I'm sure some of you are familiar with this work. Richard Louv wrote this book back in 2005, Last Child in the Woods, and he really focused on what is happening to children in this digital age. My oldest daughter was born in 2005, and or my youngest daughter, I'm sorry, but I have seen this. My childhood was very different than my children's experience because we didn't have devices. And so, like our parents would just kick us out of the house. And, as soon as we got home from school, we were outside until it was time for dinner, and then again until it was time for bed. So he really talked about the negative impacts on the health and well-being of children. But everything that he addressed in this book is affects adults as well. And it really, the research around the health benefits of nature really started to take off after that book. And, he coined the phrase nature deficit disorder in that writing. And I really think that that is kind of an epidemic, if you will, that we all struggle with. And, I started to get into the health benefits of nature during my time at MUSC. I've always been passionate about the outdoors. When I was right out of college, I started a kayak company and was doing eco tours. And I just, throughout my career, I've tried to weave it into my work in academia. But in my time at MUSC, I really had the opportunity to dig into the research. Dr. Jan Key and I were doing a study and some work with our children's hospital staff. And, those nurses, it's really hard to get them off the floor and out of the building, and they work 12 plus hours. And so we really started to look at the research. During that time, we built our urban farm, and we were trying to create outdoor spaces because we knew the impact that it would have on our faculty, staff, and students, but also patients and visitors. Some of the earliest research on the health benefits of nature were looking at patient outcomes and if they had a window to look out onto something green. Paul, you spent a lot of time in the hospital, I know, and I'm sure that you've been in lots of different rooms, and you could probably speak to this and to have a place to be outdoors. But it's in the past 20 years, we've really seen the research increase exponentially. The earliest work was really in Japan around forest bathing, and there are certainly countries that are way ahead of us. But I have just been following along with this research for years, and it is a passion of mine. And so I really started to think about, aside from MUSC and the great work that we did around getting people into the outdoors, our urban farm, our trails, our arboretum, all those things, how do we help other organizations do that? As all of you know, I am the founder, along with Paul, of the South Carolina Healthy Business Challenge. So we had a platform to help other businesses across the state create cultures of well-being and really focus on all of the different aspects of worksite wellness. But for me, I just felt like there was a gap, and this was really my calling to find a way to really prioritize nature and bring nature into the center of the way we work and live and lead. I do believe that the environment is such a powerful influence on our health and well-being and quality of life that I just couldn't deny it anymore. And I felt, honestly, what happened was I went to a conference. It's the Biophilic Leadership Summit down in Serenbe, Georgia. I don't know, some of you may be familiar with Serenbe, but it was one of the first kind of planned communities around health and wellness and sustainability and nature. It's about 30 miles south of Atlanta. So they host a biophilic leadership summit every year, and I had the opportunity to go this year in March. And listening to these amazing world-class architects and urban planners and designers talk about these projects that they do, like the High Line in New York. And, they were giving great examples of, some corporate buildings and work sites and communities that really have adopted this idea of biophilic design and well buildings and nature. And I realized that in my field, in worksite health promotion, that there really isn't a framework to help organizations implement nature-based strategies. And so that's when I decided that I kind of came up with this idea and turned it into Nature at Work. So we launched it in July as part of the SE7. It is a statewide initiative kind of centered around this idea that nature is healing and taking all of the research that exists out there and helping businesses and organizations across the state tap into that powerful um, asset that we have. So we are building a new model of worksite health promotion. And as I said, this is a statewide initiative. We are building a framework to connect employers and communities to this model and tools and resources and services that can help them promote health, both human health and environmental health. We want to create a framework to elevate our providers that are out there doing this work, and then cultivate a community and a growing network through this platform. And again, I just kind of why it matters is because I do believe that this could be the answer. I'm not saying that all the other things that we've been doing in worksite health promotion are not important, and we will continue to do that through the Healthy Business Challenge, which is much more comprehensive. But I do think that organizations who are ready to take this next step and really lean into this, that it can really address some of the issues that they're having around burnout and disconnection. And, we want to use the research to support that. So our focus areas with Nature at Work, the first is that workplace wellness innovation, which I'm going to walk through it in just a minute. That ecosystem provider support. So we will have a directory on our platform. So it's a public-facing website that anyone can visit, and there will be a directory that they can access providers that offer services to help them with nature-based interventions. Those strategic partnerships, and so that's kind of what will happen in the platform with the memberships. And then that corporate and community service is part of the model where we take corporate volunteerism and really lean into a type of volunteerism that can support the environment and people. So it is, as I said, a new model that I am creating based on the research. So there are 4 pillars. The first is focused on the built environment. And this is the indoors, bringing nature in through biophilic design, and then bringing people out. And so creating outdoor spaces that allow people to enjoy nature while they're at work or wherever they happen to be. These photos are actually from Milliken and Company. They hosted us at a site visit a couple years ago with the Healthy Business Challenge, and they are a wonderful example of how to do the built environment around nature. The second pillar are nature-based wellness strategies and practices. So these are things that we can do every day, both at work and in our home lives, that tap into that power of nature. And it has a lot to do with mindfulness, but just being outdoors, green exercise, all of those things. This picture actually is from another event that we did with the Healthy Business Challenge. This was at the Big Red Barn Retreat in Blythewood, and they have a program that they use nature to help first responders and veterans with post-traumatic stress. And so we were actually going through their meditation labyrinth, but that's just one great example of not only of a strategy, but also of a partner. And then the third pillar is that volunteerism and community stewardship. So, we all know that volunteering has many benefits to the person that is serving, as well as to the folks that they're serving. But, in particular, when you're doing something that is good for the environment, you kind of get some additional benefits. So if you think about being out planting a garden or planting trees, or, we live in the low country, we do a lot of oyster reef builds or picking up trash. You get that added benefit, doing it with your coworkers. Your employer is encouraging you and they care about their community, but they're also caring about the environment. And then because we're outdoors and we're doing those things, we get added benefits. And there are many, many organizations that have these opportunities. So we want to connect those opportunities with employers that might be looking to direct their employees to those activities. And then the fourth pillar is education and awareness. And so this is really tapping into the research, understanding how this works, why it's important, and then how to implement it. And then we also want to really lift up our organizations that are doing this great work. And so that's where our membership is designed to help raise awareness about the organizations that are doing this work. And then this is just another tool that I created. I took a traditional wellness wheel and kind of started to integrate nature into those different dimensions. So how can we include nature in our different dimensions of wellness in our day-to-day lives and in our workplaces? So I'm going to shift and talk a little bit about how you get involved, and that is that it is a membership-based organization. And so that membership will support both the public facing platform and then all of the things that we're going to be able to do together and to support that community. And it's open to anyone. And we think that there is a value and impact in each one of these different kind of categories, if you will, of membership. So all employers of all sizes and sectors that really care about the environment and care about their people. All those nature-based service providers and wellness professionals that are already doing this work, we want to connect them to employers and to organizations that are looking for that. Those nonprofit organizations and advocacy groups, again, that are promoting this work, our public agencies and municipalities, colleges and universities, chambers of commerce, students, professionals, anyone who really gets this and is passionate about nature and the outdoors, there is a place for you and in nature at work. And so again, we're building this platform. Some of the benefits of membership, members have access to a member portal. And so there will be all sorts of tools that we'll share there, both from my team and then also from all of the members. As a place. It's very similar to like a Facebook page, if you will. So members can create their own profile and you can share stories and post things and, I'm looking for an intern, or I have an internship opportunity, or I'm doing this research, or we're doing a volunteer activity. It's going to be this amazing community where we can kind of share all of those things. It is an expansion of the Healthy Business Challenge, so we want to make sure that if folks are new coming into Nature at Work and they don't know about the Healthy Business Challenge, that we're bringing them into all of those opportunities as well. And then we'll have interest groups. So we'll have groups that are specific to maybe an area of nature-based health promotion or research. I know Morgan is doing a lot of this work, so she might want to create her own group in the portal around a research project that she's doing, or we'll have those types of opportunities for collaboration in different sectors and for different topics. We are building a cohort of founding members, and our founding members are organizations that are already doing this work. They get it, they're all in, and they want to be a part of building this statewide framework. And so our that's just a quote from Mike Harris from Blue Cross. They've been such an amazing partner with us with the Healthy Business Challenge, and Mike is personally passionate about this, and so this is how we can kind of lift up our founding members. We're highlighting them on our website, and we are highlighting them in our launch events. So what we're trying to do is have anywhere from 3 to 5 founding members in each of our different categories of membership. And from those founding members, we will have a representative that will serve on our advisory board. And that group will really help to build this. There is nothing else like this anywhere. So I think this is groundbreaking for South Carolina. We have so many organizations and individuals that are already doing this and are passionate about it, and they want to be involved. And so I'm really, really excited to share this list with you. I think in particular, there are a couple different areas that I think could really benefit and could really have an impact. One, municipalities, because municipalities not only have employees, so they can take these strategies and implement them in the workplace to help improve the health of their own employees, but they also have an impact on their communities through trails and policies and the built environment. And so I think that's one area. You can see that we have City of Columbia, Town of Mount Pleasant, and Pickens County have already come on board as founding members, municipalities. I also believe that the colleges and universities have an incredible opportunity because, again, they have their faculty and staff. They also have students, and then they live in this kind of ecosystem within the community. And that's where all the research is happening. And really excited about that. We have student memberships, but you can see that Morgan knows this, but the School of Health Sciences and her dean, Wes, came on board as one of our founding members, so we're thrilled to have them. We also have Coastal Carolina and Furman University. We're working with the Shy Institute at Furman, and I'm actually in Columbia now. I'm meeting with USC this afternoon. So really excited about that. And then you can see our nonprofits and our for-profit organizations that, again, really are already doing this work and are leading the way and want to be a part of this movement. I put this in because I've been on the trail and have had the opportunity to talk with our lieutenant governor, who is now running for governor. But many of you know that she's been a huge supporter of the Healthy Business Challenge and really gets it and sees the value in this. So this is how you can connect with us. I do see a hand raised, but I just want to get through my slides and then I'll answer any questions. But we're on all of the social networks, so hopefully you've already seen us, but please follow us. I do want to mention, while I have you, that our fall seminar series for the Healthy Business Challenge is already posted on Eventbrite. We're really excited. I know everybody's talking about the GLP-1s and what's happening with that. So we are excited to have that topic for our fall seminar series. That QR code is for the Low Country, which will be on September 24th. You can see that there. We already have, I think, 65 people registered. We're halfway full already, and we haven't even really started promoting it yet. So make sure that you register early. And then I will answer any questions.
I believe Maggie Dangerfield has her hand raised. Maggie.
Yes.
Oh, she just accidentally had her hand raised.
My computer does this from time to time. I'm not sure why. I apologize. This is
Okay.
great, Susan. I'm enjoying it.
Oh.
Yeah, very, very good presentation. Thank you. This is exciting work you're doing. Yeah, Paul.
Hey, I just want you mentioned the labyrinth exercise, and when my son was at MUSC and we didn't know what was going on with him. Getting out to nature, coming out of that hospital and going to the MUSC labyrinth around your urban garden was probably a life-saving mechanism for my wife and me of getting back to that nature, to get outside and to experience that serenity out there. And I had that at Neptune Abbey not too long ago, just walking through the nature out there. That there's so much healing power out there that I was excited to see that you were taking this initiative on.
Well, I'm glad that we could provide that for you, Paul, and I'm sad to say that there are buildings being built on top of the urban farm and the MUSC labyrinth, but we're finding other ways to and other places to send people out into nature with our partnerships.
Any other questions, comments? And some people don't even realize the city of Charleston has over 120 parks. Most of those are passive parks, so there's opportunities there. I know sometimes I go over for lunch to Carl Richardson Park, and I'm surprised that there's nobody there sometimes. They've got nice picnic tables with big oak trees and lots of nice areas in the city of Charleston to get out and about.
Well, Kevin, I hope that you and April and Paul and others will help organize a meeting with your city leaders. I would love to welcome the city of Charleston into the Nature at Work membership.
All right, very good. We'll work on that. Very good.
And
I don't have a question.
oh, go ahead.
Yes, go ahead.
I don't have a question, just a few comments. Susan, thank you. This is right up my alley in my area of research, so I just appreciate seeing what you're doing in the framework that you're building. I'm glad College of Charleston can be a part of it here at the beginning. And just for the group, I know like school is getting back to session, but just a reminder about the importance of movement and activity for our children and our families. And the busyness can, kind of take over, but encourage everyone to keep that in mind and promoting that for our families. Susan, also shameless plug here, but I just had a paper come out that I wanted to share with you all because it's on this topic about what cities are doing from a policy perspective to advance green spaces. So this was published in a journal called Landscape and Urban Planning very recently with some work I've done with the Trust for Public Land. So yeah, if you're interested or want to nerd out, I will put that in the chat. It's open access, so you should be able to read it. But I did this with partners at with Kendra Stewart at the Riley Center for Livable Communities about policy for parks and green space and how we can increase access.
Awesome.
Thanks for that plug.
Great. Paul?
Hey, just as Susan mentioned city leaders, I want to take this opportunity. Tammy O'Berry is our new HR director, and she's going to be listening in from time to time. And I know she's extremely busy, but want to just make sure if I didn't know if her camera was even working, but I wanted to make sure we welcomed her today.
Good morning, everybody.
Good morning.
My camera shows that it's on, but it's black, so I'm not sure what's happening. I'm here. Nice to meet you all. Very excited to see what you're doing there, Susan. Love it. Love it. Huge passion of mine. One of my favorite parts about being downtown Charleston is that I've been here for 6 weeks now, but I can get out every day and walk. And just even if it's just like 10 minutes when it's 100 degrees outside, just to get out, walk. And it's just such a huge part of being able to enjoy your day. And doesn't hurt that we have all the horses right behind us and we can go say hello to all the horses. But really glad to be here. And I don't know what's wrong with my camera. It works fine on Teams, but is apparently not working on Zoom. So sorry, guys.
Yeah, thank you so much, Tammy, for being on here with us. And I'm sure we'll get that camera straight. But we're excited to have Tammy. She's coming from North Myrtle Beach, as I said earlier in the meeting. And we had an incredible list of candidates apply for our human resource director position. And Tammy came to the top, and she's done outstanding work in the past. And we're so excited to have her at the city of Charleston and see the great work that she's going to do for us in the future. So Tammy, thank you so much for being with us.
Thank you very much. Appreciate that.
Righty, yeah. So next on our agenda is the Fast Track Cities update and the SHAPE team. We have Luisa Ramirez and we have Tawana Philpott Brown with us. So if one of you ladies would like to take it from here, please.
Yes, good morning, everybody. Thank you for this opportunity to speak on behalf of the Fast Track Cities and our SHAPE group, which helps to promote that goal that we are trying to obtain with the Fast Track Cities. Let me just share my screen. Amazing. And then, great. So you should all be seeing my screen right now. And then we can just get started. So a little background on what SHAPE is. We are a collaboration that started in 2015 through the Department of Public Health, or what was formerly SCDHEC, in response to those alarming rates of the new STI and HIV cases within the Tri-County area, so that being the Berkeley, Charleston, and Dorchester counties. Again, like I mentioned, this is a collaborative effort. So SHAPE is made up of these various organizations that you see here at the bottom of your screen, as well as local businesses and different organizations, depending on the kind of project or initiative they're working on in the current moments. So these are just some of our most consistent partners, and we are so happy to have representatives from these organizations support our SHAPE mission. So how SHAPE is broken down, we have just like a brief overview, 2 work groups, our clinical and surveillance work group that kind of stays up to date on local and emerging topics, putting out notices when necessary regarding those emerging topics, and then responsible for our Fast Track City data. And then our communications and outreach work group kind of works as that liaison between the community and our local resources, bringing awareness to those resources through development of community events and presentations. And so to kind of expand a little bit on how those work groups, or what those work groups exactly have been working on recently, I will mention some items and then have Dr. Tawana Philpott-Brown share her experience as well. But to go over briefly, Dr. Meisner from MUSC recently spoke on HIV, HCV, and substance use disorder screenings on 2 occasions back in September of last year, and then again this year as a webinar in March. And these are aimed at health professionals. So kind of just covering those topics aimed at health professionals to just cast a wider net on like screening and treatments. And then sending out new information on availability to prophylaxis, treatment, and screening opportunities. So sharing information between about the new virtual urgent care from MUSC for NPEP, PrEP availability at the different health departments, HCV webinars, and the Viral Hepatitis Committee, also through the Department of Public Health, adjustments and treatments on certain STIs, specifically on syphilis with different shortages and in treatments, and then a new GIS locator that went out through the Department of Public Health, showcasing all the different places around the state that you can go get tested. They can go get tested, treatment, the location, and so really just great tool there. And then Dr. Tawana, I wanted to let you speak on the opportunity that you just had speaking at a Fast Track City Town Hall meeting.
Sure, Louisa. Good morning again to everyone who I have not had the opportunity to say good morning to. So just a little bit about me. My name is Tawana Philpott-Brown. I serve as the program director at the Roper St. Francis Health Services Center. We were formerly the Ryan White Wellness Center, and there we serve people who are HIV positive, and we also have a PrEP and prevention program. So a little bit about Fast Track Cities. Fast Track Cities is a collaboration between cities and municipalities all around the world, committing themselves to attaining 90-90-90, which means 90% of people living with HIV are aware of their status. 90% of diagnosed people living with HIV are on HIV retroviral therapy. And then 90% of people living with HIV on antiretroviral therapy will sustain viral suppression. So that is a commitment that people from around the world and in the United States have committed to. Our former mayor signed a declaration for the city of Charleston, I think back in, Paul, help me out, what year was that?
It was 2019 and it was updated in 22 or 23.
Correct. So at that time in 22 or 23, they did have a in-person town hall in Charleston, and I had the opportunity to serve on a panel at that time. And we talked about our housing innovation here at Roper St. Francis, where we say housing is healthcare. And from that, they offered us to come to Amsterdam during their annual conference to talk about our master lease program that we had here in Charleston. And then most recently, I had the opportunity to serve on a panel here this year talking about saving lives and fighting to preserve our gains. And so we talked a lot about the current landscape and what the service disruptions, the type of impact it have on our programming. And so that's what I talked about most recently. And what I shared with the group at that time is that 2 years ago, we really did see an uptick in our Hispanic population coming to our clinic, which is directly a reflection of us having bilingual people working in our clinic. And so what we know about the Hispanic population, if they feel comfortable, they will come. And so we were ecstatic and excited about that because we were catching people who were HIV positive who otherwise was not in care. But because of the current landscape, we have seen a decline in our Hispanic population. So those are some of the things that we talked about. We talked about some of the Medicaid and Medicare restrictions that's coming down the pipeline. And we also discussed about funding and how we want to be sure that we diversify our funding streams in the case that we may lose our federal funding. We have been very fortunate and blessed that we have not lost any federal funding at this time, but that is not the case for most of our partners around the country. And so that's kind of what we talked about in the last Fast Track Cities Town Hall. We also talked about strategic partnerships, and I bragged on Charleston and how we collaborate so well with Tri-County Shape and all of the health organizations here in the area where cities are just now doing that. Charleston really has led the way, and we've been collaborating for a long time because we know working in silos does not work, and we're truly are stronger together. And so that was the last topic that we discussed at the last Fast Tracks Cities Town Hall, which was virtual on that one. And I will hand it back over to Louisa.
Awesome. Thank you so much. And we will kind of loop back to the Fast Track City initiatives and the different conferences and summits that they have in a couple of slides. But just to recap some of the other projects and work that's been going on within our communications and outreach work group. So back in April, March, and May, we had a 3-day programming at the College of Charleston, kind of like that trainer the trainer model, where we invited college students that are interested in potentially working in sexual health education professionally after they graduate. And we were fortunate enough to have 25 graduates. We had 100% retention, which we were so shocked and so thrilled to have because they're college students that was in the midst of finals, and everyone showed up. They showed up for the second, and then those that weren't able to show up for the second came back and showed up for a makeup day. So we were super great to have that. Our pre and post testing indicated that we had a 15% increase in knowledge, specifically in identifying STI symptoms and understanding contraceptive methods. And this was such a great success for us that we've already been asked to come back for the fall semester and do this training again. And hopefully one of our goals is to be able to replicate this training, modify it slightly, and be able to expand it to other universities, technical colleges in the area, and provide the same kind of information. Similarly, we also hosted our Project Condom fashion show that we do annually in North Charleston. And that was just a great opportunity to highlight those local resources in providing STI treatment, HIV treatment, and screening resources. And then to kind of help normalize that discussion around safer sex practices, make it something that's not super scary, and really great way to target those people living with HIV, the LGBTQ plus community, and then young adults in the age group of like 16 to 24, which are all those priority populations when it comes to HIV prevention or STI prevention. And then last year we did host our World AIDS Day celebration on December 1st in downtown Charleston, and we have already begun our planning for this year's World AIDS Day celebration. So just kind of like a little visuals to those projects that I mentioned. There's some pictures from our Pride event and Project Condom fashion show, and then this past year's World AIDS Day that we did have in downtown Charleston at one of those great local parks that we were just talking about. And then for our further involvement, to uplift the work that we do here and to kind of be able to expand and reach those 95, 95, 95 goals through the fast track cities that are aimed at for 2023. We're asking the city of Charleston to consider sponsoring 1 to 2 members to attend the annual Fast Track City Summit. They do a conference every year abroad somewhere, and then also have a more local US Fast Track City Summit in a city or in the United States. And so we're hoping that City of Charleston may be able to consider sponsoring 1 to 2 people to kind of help expand and sustain the project, scale our effective practices that we've already been working on, and kind of help close those persistent little gaps that we have in supporting the Ending the Epidemics initiative. And then also, in addition to just helping us plan and collaborate with our 2025 World AIDS Day initiative, we are hoping that Tri-County Shape may be in consideration for some kind of financial support or just like social network support during this year's event.
And just to add to that, we normally when we have events around town, we sometimes have trouble finding space for the events. Or last year we wanted to do a vigil on World AIDS Day and do kind of a walk in an area, but then we found out that we needed the streets blocked off, we needed police presence, etc. So any support with event space or police presence, or if we have to block a street off or two for a World AIDS Day event, that would be greatly appreciated.
Yes, absolutely. And then if any of those things sound like something that you think the city of Charleston would be interested in helping us this year with, please feel free to contact myself, Dr. Philpott Brown, or Katie Richardson, who's usually on these calls, to kind of help just learn more, maybe have some further discussions. But we do really appreciate the opportunity to be able to come and speak about the work that we're doing so far and the places that we want to go with what we have so far. So I thank you all again.
Yeah, thank you very much for that presentation. Any questions for the SHAPE team? Well, thank you again for all that information, and we appreciate all the work you're doing too. So next on our agenda is our community health update. Dr. Richardson's not able to be with us, but Cynthia Mwangu is the Director of Community Engagement, is going to fill in for us for our community health update.
Good morning, everybody. I do not have much. I cannot cover everything Dr. Richardson always share with you guys. But with the Department of Public Health, I share the link with the poll, the email. We do have a new portal they call Simon Portal, which is kind of encouraging parents to utilize for the first time online link in order to get their children immunization record. In the past, parents have to go to public health to receive those. So for now, student from 5th grade to 12th grade, parents, they can go online under the link of Simon Portal under DPH, and then they can just request their immunization record in order for their kids to be able to attend the school. So for that, I just I think is a good improvement within our agency to make it easier for parents to get resources. And then also, I just want to highlight we are in the hurricane season. I believe pretty much everybody has a plan, the family planning, what's going to happen. We don't know. We're knocking the wood. We don't want a hurricane to happen, but here we are, you know. So as DPH, also I share the link with Paul as well. We all focus on we call medical equipment power shelter. That's what DPH is focusing on. And then the Red Cross, they always focus on public shelters. So we do have couple of shelters here in the Low Country region. I just want to mention them. So in the events, um, our department is going to be solely focusing on individual who may be using oxygen. They need to have like a power in order to have something to sustain their everyday activities. So those places are Westview, which is in somewhere in Goose Creek, Red Bank, no, Goose Creek area. And then we have Orangeburg County, Somerville, Colleton, Jasper, and Vaughan University. So most of these places we're trying to be kind of keep farther from the coast. You know, we are in the Low Country region, so people they can be evacuated. And most of these places they have generators. So if you have a loved one who has using oxygen, and we have those kind of events, normally we're gonna shelter them to make sure that they can sustain during those difficult time until we resolve those issues. And then another things we are working very closely with our community is breast cancer screening. Our DPH work very closely with MUSC and the Lower St. Francis. So we always trying to offer those in our health departments. So for example, in Charleston and Berkeley County, some of the health department, we do have those screening. So I'm just kind of sharing that always we gonna share that information when it's come fluid with our community partner, and also we're gonna share with this group when we have those lists, the days and time when folks they can get free breast screening in order to increase access to care, because we know not everybody has those in our community. And then the last not least, my team is working very close with the Head Start and the First Step initiatives. And these groups, we always work on oral health initiatives and promoting health. You know, I know Dr. Susan just share physical activity, you know, utilizing outdoors, similar way. We work very closely with our younger population because we believe the next generation, if they are more equipped with all this knowledge and understanding, utilizing them, that can improve their well-being moving forward. So we work very closely with the Head Starts and First Step groups, kind of encouraging parents, could be like reading storybooks to their kids, helping them to brush their teeth, and then outdoor, because now there's a lot of parents give their kids tablets. So we say like, hey, take your kids to the park, you know, spend some time in the playground. That can impact the kids' well-being in the moving forward. So those are the things I just try to share with this group, and I hope we can continue working together, you know, as many of presenters say, like we cannot do alone, you know, so this is just like a multi-dimension, different community partners and organization coming together to push the envelope to the next level when it comes to promoting health. So that's all I have. Thank you for having me.
Yeah, thank you
Any
very
question?
much. Yeah, any questions? Anyone? Well, thank you very much for that report and filling in today. We appreciate it, and yeah, thank you for all the work you're doing. So, all right, we will move forward to our community health and wellness updates, and I'll just kind of look for hands here if someone wants to raise a hand and give an update. Anyone?
I could go if that's okay.
Yeah, thank you, Jennifer Brush.
Yeah, good morning, everybody. And thank you again for the nice comments on the Low Country Mental Health Conference that was last week. Thank you for supporting it. As I probably mentioned hundreds of times to you, the revenue from the conference goes to help our patients with financial crises, maybe medication or housing or things they need to get a job. So all of the all the revenue goes to help patients in the Charleston, Dorchester area. So thank you all for your support every year, and we'll continue to try to make it the best ever every year. We try to make it even better than the year before. But I do have some news. Paul's putting something up. Are you putting the flyer? Thank you. So this is hot off the press. Perfect timing for the Health and Wellness Committee. Our Columbia office received a grant for a virtual workshop for a suicide training. And there's two workshop dates. One's August 27th and one's September 8th. These are for people who serve youth and young adults under 24. It looks like it's a 3.5-hour training. It says primary care pediatricians and any staff serving youth at DJJ, hospitals, foster parents, DSS, child care agencies, pretty much everyone. So it's kind of a good time to share this with y'all as part of health and wellness and trying to save lives of kids with suicide prevention. So please share this with your peers and coworkers and anyone you think that may be interested in attending one of these two trainings that's paid for by a grant and put on by the Office of Mental Health. And that's kind of all my news. I was on vacation for a week and a half in Croatia, which was beautiful. Talked about nature and beauty and rest and fun, and then came into the conference the week when I got back. So trying to get back to what we do here, serving patients here at the Mental Health Center. So nice to see everybody again, and thanks again for your support.
Thank you very much, and thank you for being back with us with all that you've had going on, because I know you're exhausted, but thank you for being with us this morning and sharing too. So Tawana Philpott Brown.
Hey, how can we get a copy of that flyer?
I'll send it to you.
Okay, thank you.
Anyone else with a community update?
Nick.
Oh, Nick, please go ahead, Nick.
Yeah, thanks very much. And I think Paul's probably putting up what I'm going to talk about. So Paul, thank you very much for reading my mind. So just to let everyone know, we have our 5th annual Walk to Fight Hunger event taking place in September the 20th. This year we're doing it on a Saturday as opposed to the Sunday that we've done it historically. It's at Wanamaker Park. Again, this is where we've traditionally done this. This is an event that we do each year to correspond with Hunger Action Month. It brings our community together to unite around understanding the challenges and issues associated with hunger and food insecurity. It's a great opportunity to come together, and as part of the subject of what we've been talking about today, it's a great opportunity to get outside and participate in a walk as well. There's some selections of different types of walks to do, but please, if anyone is interested in coming and attending, or please share the flyer. We would love to see everyone on the 20th of September.
Very good. Thank you very much. All right. Anyone else for community updates?
Yeah, Kevin, I'd like to say something if I could.
Sure, absolutely.
Hey, everyone. I just wanted to let you know that I am now working for Medicare on the National Diabetes Prevention Program. We're actually, contrary to what you may or may not be hearing, but in this particular realm, Medicare is not cutting funding. There's plenty of money to get out in the community and offer this prevention program around type 2 diabetes. I'm currently, with the help of my coaches, running 2 programs, one up in Del Webb in Cane Bay, and then another one at another 55 plus community in Somerville. So if you have access to a lot of folks that are 65 and older, this is a free program if they're on Medicare Advantage or Medicare. Unfortunately, because we're not a Medicaid expansion state, it's not covered by Medicaid. But if you know anyone and those who get either Medicare or Medicare Advantage, the program is free. The biggest challenge I've got is just finding this population. And we run the program virtually and on site. So anyway, just anybody in this community who knows this population, where they hang out, besides at 55 plus communities, I'd love to talk to you about possibly getting a program going because the
Great.
money's there. It's definitely there.
Great. Thank you, Lisa.
They
Sure.
hang out here. I'd love to have more information. We have a lot of patients in that age group.
Okay, Jennifer, let's talk.
Okay.
All right, very good. Paul?
Kevin, just to remind everybody, we got schools are starting next Tuesday for Charleston County and next Thursday for Berkeley County, that'll have our residents in, but Sunday at the Gilliard and extends down to Liberty Square and the aquarium, the First Day Festival continues in Charleston. And not only is it a good time to come out and get resources for school, but it's a great time to get resources for life, such as healthy living and what partners are out there to support you in a lot of different areas as a parent and for your children. So it's a fun time, and I know Maggie and them will be ready when school starts because they are busy right now getting ready for it. So
Yeah, thank you, Paul, for that reminder. Maggie, anything to add there?
We're so excited to welcome everyone back on Tuesday. Our teachers came back this week on Monday, back on contract, and so they are working all week long to ready our classrooms, greet and meet our families, participate in professional development, and then we'll welcome our students K through 12 on Tuesday, and then our child development, our 4K students, and Head Start begin the following week at a staggered entry for those 4K students on the 18th. But we will have at least a dozen or more departments out at the First Day Festival on Sunday here on the Gilliard lawn, providing information, resources, school supplies, to help ready our families and our students for the new year. So please come out and see us. We also have been holding a series of registration pop-up events all summer long, whether it was a Tuesday playground pop-up event in Park Circle or one of our weekend pop-up events at different high schools around the county. We have culminating events this Saturday, August 9th, at 2 high schools. And so we would welcome any families who have not registered their student yet for the new year to come on out. Let us help you get registered and enjoy a sweet treat and some school supplies from some of our partners. And we are also, last night we hosted our first of 2 Facebook Live events, particularly with transportation and our first student partners. So if you weren't able to tune in last night and you do have some questions, please feel free to go back on to our CCSD schools Facebook page and view the video. There's also links in the chat there for our transportation FAQ that have lots of helpful questions and answers about, in particular, the new First View 1.0 app. And then we'll host another live on August 19th on the same topics, kind of as the year has begun and new questions or new areas of curiosity have emerged that we'll answer with our partners from First Student then. That's all I have.
Great. Thank you so much, Maggie. Appreciate that.
Kevin, I couldn't remember whether you said it at the beginning of the meeting or not, but sitting behind me is this beautiful old tree. And, as we speak to nature, the visitors, I would guess it's 100,000 people probably go through that tree, or maybe it's over. Let's just say it's a lot of thousands of people go to that tree. But that tree is it's been a fixture for our community, and it's great that it just recently got honored as a community forest by the Old Growth Forest Network. And they're going to build a 44-acre park mainly to take people from parking on the root system and move them further away so that the tree will have a longer life ahead of it, and by us expanding it and telling the story of what the memories of what a beautiful tree has brought to our community. So As for Susan's honor, I put back there today to remind us that we have nature all around us. We just need to get outside and enjoy it.
Yeah, thank you, Paul. Appreciate that update. I mean, everybody knows how quickly Johns Island is developing too, and that protects that property from being developed as well. So, you know, it's great. We appreciate the Low Country Land Trust and all that they do and working with the city of Charleston to make things like that happen. So thank you. Last night, there was also on the east side, we had oh shoot, what you call it, National Night Out. The Charleston Police Department and the community came together on the east side for National Night Out. I understand it was a great event as well. So, all right. Anything else for this committee? Well, I want to thank everybody for your time. I know your time's valuable. Appreciate you giving us an hour this morning to help us have better health and wellness in the city of Charleston. We certainly value your time and your expertise and appreciate you giving that time to us. So if there's nothing else to come before this committee, we look forward to seeing you on September 3rd at 8:30 again. And do want to remind you before we go, though, that if you'll go to the YouTube channel, you can hit like on there and follow this page, but certainly share that that the Health and Wellness Committee for the City of Charleston is out there. People can see our meetings. So, and please share that. If nothing else to come before this committee, we stand adjourned. Thank you so much.
Thank you.
Thank you.